Hello everyone, my name is Victoria Batten and this is my older adult presentation. Before I get started, I did just put a little trigger warning on this video because I will be discussing some physical and sexual violence that the subject of my interview faced during her childhood. So throughout this presentation, I will be discussing the case of a former client of mine who, in this case, we're just going to call Jen. Jen participated in an interview with me where we discussed her experiences. The following is just a brief summary of Jen's case and just kind of her life story and everything before we get started with her specific life stage that I chose to work on. So I knew Jen. She was a 65-year-old woman who was presenting in treatment at a behavioral health facility for alcohol abuse and mental health stabilization. Jen explained during her interview that boundary setting and self-esteem were major things that she was working on during her treatment stay, as she had struggled with these things her entire life. Jen described her childhood in detail, stating that she was born in a small town in Indiana in 1956. Her father worked for the railroad and her mother sometimes worked part-time. Jen had an older brother and an older sister who were more than 10 years older, and then a younger brother who was 19 months younger. Jen stated that because of her father's job with the railroad and then later in her youth with General Electric, they moved around frequently, living in several different states and even other countries. Jen recalled several events while growing up that impacted her. For starters, Jen explained that moving around so frequently gave her little time to get acquainted with peers and with schools. Because Jen was in places mostly for a short amount of time, her learning disability mostly slipped through the cracks for many years. Jen also recalled having very few close friendships throughout her grade school years. The second types of contributing events were abusive events. Jen was sexually assaulted for the first time by a stranger in her neighborhood when she was 3 years old. And she stated that the effects of this were night terrors and bedwetting. Jen's family did not know that this happened. At age 7 and then again at age 10, Jen was molested and assaulted by acquaintances. Jen reported that her response to this was acting out. In her teenage years, Jen had a boyfriend who she described as being every type of abusive you can imagine. Jen detailed how he got drunk and made her get in the car with him, and they got into an accident where Jen was thrown from the vehicle and severely injured. Jen reports lasting effects from the car accident both physically and psychologically, as it is a major contributor to her PTSD. The final thing that Jen detailed about her childhood was her relationship with her family. Jen explained that when she was about 10 and her brother was about 8, her brother started to get in trouble frequently. Jen shared that her mother devoted much attention to her brother, getting him involved in activities like Boy Scouts and hockey, and even participated as the den mother. At one point, they even moved houses so that her brother could walk to his hockey practices. Jen stated that her father was working and her other siblings were not at home anymore, so she felt missed and uncared about. Jen described her brother as her best friend prior to this, but stated that once the change happened, she felt a lot of resentment toward her brother. Jen identifies this as where she started having issues with self-esteem, as she felt like she was not good enough to receive attention. Jen graduated from high school in Brazil, where her family was living at the time, and came back to the States for college. When Jen was about 20, she met a man at her junior college in Kansas City, and they ended up getting married at age 22 and moving to Pennsylvania. When Jen was 24, her father passed away, which she identified as a very difficult event for her, as she sometimes felt like he was the only person in her family who cared. Jen stated that throughout her life after his death, she wondered if he could see her life and her family. At age 30, Jen had her only child, a daughter. Jen stated that when her daughter was 3, she started to exhibit symptoms of PTSD more, such as flashbacks to her childhood assaults, anxiety about her daughter being okay, and depression. Jen said that she started to drink and to help her sleep, and that this was only occasional. Jen eventually saw a psychiatrist and started medication, during which time she stopped drinking. Around age 36, Jen and her husband separated. Shortly after, Jen started to drink again, maybe once every 2 weeks. By age 42, Jen reported drinking a beer every other day. By age 45, Jen was drinking 4 to 5 beers a night. Jen also reported that during her late 30s and early 40s, she was in a relationship with a former therapist who was physically and sexually abusive. Around age 50, she moved in with a friend who introduced her to martinis, and she started to drink more liquor. She was off of her medications at this time due to not having insurance. Around age 53 or 54, Jen moved into a boarding house, but this triggered her PTSD from her car accident as a teenager because she had to walk along a highway to get to work every day. She continued to drink to cope with these symptoms. At age 55, she became depressed and stayed in bed for 5 weeks. She finally called her daughter, who got her a motel until shelter was available for her. At age 56, she entered rehab for the first time. During her early rehab stays, they treated her mostly for her mental health and referred her to psychiatric facilities where she felt that there was little benefit. Jen reports having been in and out of treatment since with some periods of sobriety. Jen reported that her motivations for treatment were so that she could get better, she could be a better mother to her 35-year-old daughter and a better grandmother to her 2 and 9-year-old grandchildren. Her biggest goal moving forward from treatment was to be able to get her own place and to be involved with her family. The biggest barrier that she felt she was facing was being able to manage her PTSD and depression. So, the stage of Erikson's theory of psychosocial development that I chose to focus on was the industry versus inferiority stage. I chose this stage, which is approximately ages 6 to puberty or the age of 11 or 12, to focus on Jen's case because it seemed that many major events happened during this time that affected her, later on in her life. These events included the 2 sexual assaults at age 7 and 10, several residential moves and relocations to different areas, her undiagnosed learning disability, the shift in relationship with her major supports, which were her family, and then a lot of feelings of being unwanted or not good enough. And that's kind of where those feelings stem from. At least that's how she identified it. So the inferiority versus industry stage, according to Rogers, the stage consists of needing to be productive and successful, playing, learning, and figuring out how to do things. Children in this stage who are successful become industrious, and then children who experience failure frequently will feel inferior to others. Feeling inferior can hamper children's chances of ever fully succeeding. So, the first kind of major event that I wanted to talk about during the stage was the sexual violence and kind of how it relates to the stage and then how it affected Jen's development. So, the sexual violence was not a failure on Jen's part, it was a failure in the environment around her. According to Briere et al., 2020, children who experience sexual assault are twice as likely to experience sexual assault later in life. Knoll et al. In 2003 did a study to explore sexual development of children who experience childhood sexual violence and explained that children who experience sexual violence are more likely to either have sexual aversion or hypersexualized behavior throughout the rest of their childhood and into adulthood. I think that this point is kind of important in Jen's case because she had the sexual assault when she was very young, and then again during this life stage. And she also reported being sexually abused or in sexually abusive relationships during her adolescence and adulthood. And then, according to Peterson in 2018, children who experience sexual violence and have little support are likely to develop mental health symptoms such as depression, anxiety, and PTSD. During the interview, Jen explained that after the assault, when she was 7, she would act out sexual encounters with her dolls. Jen also engaged in unhealthy sexual relationships with a treatment provider in her adulthood. Jen's adulthood experiences of sexual violence, along with her lifelong struggles with mental health, could be direct effects of Jen feeling inferior after these events during her childhood. All right, so the next kind of thing that I want to address from this stage in Jen's life and how it relates to this stage and how it affected her development was the parental favoritism and sibling issues. So, Jen felt that when she was around 10, her mother started to turn all of her attention to her brother and his activities just to keep him out of trouble. Jen reported that this caused a rift between her brother and her, making their relationship very tense and sometimes violent after this. Jen also reported that this is when she started to have low self esteem and feel that she was never going to be good enough. Jen reported feelings like her father was the only person who cared about her and that he was always away for work. These are just some examples of ways that Jen felt inferior with her family. And then some of the research just shows Suter in 2009 looked into parental favoritism in both childhood and adulthood and determined that parental favoritism during childhood was more likely to have traumatic effects during adulthood. Um, and then they also explained that the disfavored child, with with in terms of parental favoritism and everything, is more likely to have negative effects on their wellness. And then, according to Feinberg et al. In 2012, there is some correlation between parental differential treatment and negative sibling relationships in childhood. Bethel et al. In 2021 described that the way siblings can help with communication if they have a quality relationship, including pro-social behavior, communication, and then also literacy. This article also stated that the quality of sibling relationships is one of the most important long-term predictors of mental health in older age. And then finally, Natsuaki et al. In 2009 stated that aggressive, coercive, and hostile interactions with brothers and sisters provide an arena for direct practices, observational learning, and reinforcement of problem behaviors that subsequently lead one to experience failures at school, with peers, and in future relationships. So the research kind of aligns with Jen's development as she does struggle with her mental health, substance abuse, low self-esteem, and boundary issues within her adulthood. Jen also reports not being very close with her brother in adulthood and did not really identify him as one of her potential supports at this point. So the last kind of part of Jen's life during this stage that I wanted to talk about was the residential mobility and how it relates to the stage and how it affected her development. So Jen reported that her family moved around frequently when she was a child, sometimes more than once per year. Jen shared that when her father passed away, him and her mom had been married for exactly 40 years, and in those 40 years they had lived in a total of 39 different homes. Jen felt that she never really got to make friends because they were always moving. Jen stated that in the time that she grew up, there was also not cell phones and social media, so she would lose touch with people that she did become close with. Some of the research is listed here. According to Levine, Coley, and Cull in 2014, moving multiple times during childhood can put a child at higher risk for issues with performance in school, social skills, and behavior. This article also states that residential moves during early and middle childhood have long-term effects on social and emotional outcomes, suggesting that stability is particularly important in early life. The last little thing was that in Oishi 2010, they provide an example of an adolescent basketball player who moved often during his childhood. And he perceived himself as being a good basketball player, but did not ever envision himself as being part of a team because he didn't feel that he was ever in one place long enough to join a team. And this kind of shows some of the social effects and provides an example of how residential mobility can make a child feel inferior. Jen did report some positive effects from the residential mobility. She got to live in different countries at some point, learn different languages, and learn about different cultures. However, this was more in her adolescence than in her early childhood.